Throughout your journey to adoption, you may hear professionals referring to a child's level of care or level of need. These levels of care include needs or disabilities that can be physical, mental, emotional, or developmental. It's important to remember that levels of need can change over time as a child ages, progresses, or has phases of regression. Mild level of care typically categorizes a child as needing basic services. Youth with mild defined needs have the capability to respond to interventions such as limit setting or redirection. To see examples of what is categorized as mild level for each category, refer to the Adopt Kansas Kids Level of Needs Definitions form located on our website. Services for a mild level needs child can include things such as individual therapy, medication management, possible speech, occupational, or physical therapy, educational supports like an individual education plan while still remaining in the classroom. Moderate level of care typically categorizes a child as having problems in one or more areas of functioning. Children with moderate levels of needs tend to need more individually specified interventions in order to meet their needs. Required services for a child with moderate levels of need may include supports such as behavioral interventionists, waiver supports, including the intellectual developmental disability waiver, education supports that may need to occur in combination of both in and out of the general classroom or with the help of a paraprofessional. A potential history of acute hospitalizations, placement in group homes, qualified residential treatment programs, or secure care. Additional medical specialists to provide specific diagnosis with coordinating ongoing treatment. Severe level of care typically refers to youth with needs that present a safety risk of harm to self or others and often need intense intervention or safety planning in the necessary areas of functioning. Services for a severe level needs child can include things such as the need for consistent and constant supervision, inability to perform daily self-care skills, educational supports that typically involve the child receiving an education outside of a traditional school setting, such as an alternative school. Persistent placement in youth residential centers, also known as group homes, qualified residential treatment programs, psychiatric residential treatment facilities, and secure care. Remember, some of the services mentioned above are just examples of the types of supports a child may need. For more detailed insight on what types of supports may be needed for children with mild, moderate, or severe need levels within the various categories of functioning, please refer to the Adopt Kansas Kids Level of Needs Definition form located on our website. Oftentimes, a child's need level can change as they participate in services to help address a need or as a traumatizing event happens that may cause a moment of regression. The idea of adoption can be fearful, exciting, and stressful for youth in foster care. During the adoption process, an adoptive parent may see a child's level of need in a specific category fluctuate. As your family prepares to learn about the needs of children you may be interested in adopting, there are many trainings available that we highly encourage you to take. Informing and educating yourself on trauma-informed care will be an important step for your family as you wait to be matched with a child, as well as post-placement of that child. For a full list of available trainings, visit the Children's Alliance website, childally.org. Be aware there are a variety of resources available for adoptive parents to access. Oftentimes, places such as mental health centers, community developmental disability organizations, or even programs within a school district can offer supportive services for youth who may have a change with a specific need or disability. If you find yourself in this position and are unsure where to reach out for assistance, remember you can always contact the Kansas Post-Adoption Resource Center, KPARC. KPARC offers no-cost services to all families who have adopted. More information about the Kansas Post-Adoption Resource Center can be found at adoptkskids.org under the KPARC tab. We also welcome you to watch our informational video highlighting services offered by KPARC.